1, and welcome everybody. Thank you for taking the time. I know Linda is the chair of this committee, but I'm going to be chairing this particular meeting this afternoon, and know that she'll join in just for comments. So does everybody have the handouts? We have 3 things. We have the agenda, you have the minutes from the September meeting, and you also have a handout with the meeting dates for 2022. Did everyone get that who's on the committee? Okay, so we have a couple of guests. So very quickly, if we could just start, Jordan and Lori, I know you were on before, but if you could just introduce yourselves, we'll just go around and we'll start with you and just have a little bit of introductions.
Sure, I'll start. I'm Lori Johnson. I think some of you have met me before. I work with Edith at the Department of Public Health on this project and some others as well. And I'm joining you today to talk about, for follow-up on our last conversation related to the new OVS SAFE brochure. Thank you for having us.
Thank you. Jordan?
Hi, my name is Jordan. I work with Lori and I help manage this project and keep everything moving smoothly.
Yeah. Thank you. Edith?
Hello, everyone. Good afternoon. My name is Edith Atrevoir. I am the program coordinator for the Sexual Violence Prevention Program at CPH. Thank you for having me.
Whoever wants to go next. Natasha?
Hello, everyone. I'm Natasha Pierre, the State Victim Advocate for the Office of the Victim Advocate.
Lucy? Oh, you're on mute. Our favorite phrase.
I thought I'd unmuted myself, but thank you. I'm Lucy Nolan. I'm do policy and public relations with the Connecticut Alliance to End Sexual Violence, and I'm stepping in halfway for Beth Hamilton today, who couldn't make the meeting. But I would also like to be on the list for these meetings if possible, because I also chair the Sex Assault Kit Initiative work group, and part of my job duties are attending this meeting as well. So
Great, thank you.
You'll be seeing more of me.
Great, thank you, Lucy. Marielle.
Hi, good afternoon, everyone. I'm Marielle Daniels. I work for the Connecticut Hospital Association, and I am on all the sexual assault related response groups for CHA on this particular issue. So that's why you see me here as well.
Thank you. Pat?
Hi, everyone. I'm Pat Moriarty. I'm the SAFE Program Training Manager, and it is also nice to be here.
Allison?
Denise, that's Allison Chandler from External Affairs. She's the link with YouTube.
Yep. Sharmise?
Hi, I'm Sharmise Walcott. I'm the State's Attorney for Hartford, and I'm here as the chair of the commission on the standardization for the Marielle, help me out, right? Chair for the collection on the standardization of evidence in sexual assault investigations. Linda, did I get it? Yeah.
Yeah, I was gonna say you have to defer to Linda. She's the pro. I still call it the commission.
Yes, I'm going back to it. So I'm here, kind of in the background listening in. I have an infant who is, I'm trying to get her to sleep. So if I'm off camera just for a moment, that's why.
Can we get to see her?
Oh, yeah. Wait, and I think she might even smile for you.
Oh, look at that.
There she is.
What a cutie.
Oh, Sharmise.
She'll be 3 months next week.
She's beautiful.
And then we're going to start daycare.
Wow.
Thanks, guys.
Thank you so much. She's adorable.
She
Thank you.
is.
Thank you.
So Denise Pansini?
Hi, can you hear me?
Yes.
Okay, I can see you on my screen, but I had to call in order to be able to talk to you. So I'm Denise Pansini. I'm with the Judicial Branch Office of Legal Services.
Okay. Jean?
Jean Weisbrod, and I provide the administrative support for the advisory committee. Thank you.
Thank you. And Linda?
Hi, everybody. It's nice to see everyone. Linda Semino, Director, Office of Victim Services.
Okay. And did I miss anyone? Okay. I feel like I've accomplished something for the day here. And I'm Denise Covington. I am the program manager of the SAFE program and chairing this particular meeting. So did everyone get a chance to review the September minutes?
Yes.
Okay. I'm going to make a little notation, Jean, just for the minutes, because in the minutes, Heather Deming had offered to basically allow us to provide information about the SAFE program at her Ascend conference. And we had needed to have a legal review of that. And unfortunately, we were just not able to take advantage of it this time. But we're hoping to take a future opportunity of the Emergency Nurses Association. But I just want to, for the record, express our appreciation for her efforts. Is there, I believe we have a quorum. So is there a motion to accept and a second?
So moved.
Second? Was there a second? I think some people are on mute.
Oh, sorry. Natasha did a second.
Okay. Any further discussion? Okay. All in favor? Just raise your hands, we can see. Okay. Any nays? Any abstentions? Okay, so moved. So next we have on the agenda, we're looking forward to having this update from Converge and from Edith. Edith, you want to take it away?
Sure. Thank you, Denise. So I've been working with Converge Marketing to do the revision of the pamphlet for the OVS. And in this pamphlet, it will just contain information about where to get tested for HIV and STDs. There was it was a little bit outdated. I think the last time it was revised was when 2017, 2017. It was a while ago. And we only had a PDF form, and that was it. So thankfully, I was able to work with Converge Marketing to just have some ideas for the new pamphlet, and I'll gladly like for them to take it away and show us what we got so far.
Okay. Thank you, Edith. I'm going to share. Oh, I cannot share. Would you like me to share, Denise?
Yeah, I think, let's see. If this was a different format, I don't think I can, it does not appear that I can offer you the opportunity to share.
Okay.
Can I just interrupt 1 sec? I'm sorry. Edith and Lori, excuse me for 1 second. I just want some clarification because this, I think, the second time I've heard this. The brochure that you're creating is by statute, which is 19A 112C, and it's the Department of Public Works and now the Alliance, it was Contacts, to develop educational materials about HIV acquired immune deficiency syndrome. And so this is a DPH brochure that we use in our materials that we give to sexual assault patients. So again, by statute 19A112C, it's a collaborative effort between DPH and the Alliance. We're thrilled you're bringing it here, but I keep hearing that you're doing this for us, and it's not. This is a statutory requirement that your agency, Edith, has.
Thank you, Linda.
So I apologize that I am not able to because I don't have the presentation. If you were to send it to me, I could probably share it.
Oh, okay. Let me try that. Give me 1 second. I can. Let's see. That's why I was using two.
Oh, I see what you were doing before with the two screens. Yes, yeah. I get that.
Yeah, that's okay. No worries.
So do you have my email address?
I do.
Okay.
Let's see.
Technology is just a wonderful thing.
Until it isn't, right?
Until it isn't, yeah. But hey, you know what? It's better than what we would have had if we didn't have it.
That's right. So, imagine us all on some phone call trying to do this.
Yes, trying to do this.
So I just emailed it to you. So
okay, and I'm watching for it to come up.
Okay. So in the meantime, I'll just chat a little bit about the first thing I was going to share is just a quick reminder of what we talked about last time. So we wanted to, the direction from everyone in this meeting was to include the following. Make sure that there were QR codes so that we could have a digital version of the entire pamphlet and also portions of it. Translation into Spanish and Polish, possibly Mandarin, which I guess we can make that decision as we move forward. The approach was to compare it with the existing, the new judicial branch brochure to make sure that we weren't duplicating anything in the two. But to check with CDC and other public domain sources to see if there was anything that could be used from an advocacy perspective, or to persuade the victim to pursue not only their rights but also the care and precautions that are recommended and following an assault, and also focus content on asking the victim to talk and follow through. Include a list of questions that the victim may want to use with their healthcare provider for tests, and include also a folding card that would be, sort of a very, very mini version of this pamphlet that would also have a QR code. So what we found in our research, Jordan led this up for us. We found several topics where we could use sort of snippets in the brochure that might help to organize a victim's pursuit of care. And they are caring for children, caring for yourself and how others can help you, the risks of HIV. Some of these may or may not have been in the 2016 version, but they were not in any other current version.
Am I able, do you see it on the screen or no?
I do.
Okay. So, let's see.
So do you want to just page through? This is the cover.
Sure.
This is the front cover. This is an example of what those little sections would look like. So for example, what you're looking at here is caring for yourself. It's just a little blurb taken from public domain direction. And then a QR code. That QR code can include whatever you like. It could include more information on that topic, or it can just go to an online directory. And you'll see that we put in a QR code. We put in a QR code after each little subsection. We do have to, if you look really closely, you can see it's a test QR code, but we have to make sure, of course, that it's legible so that it will work with a camera. But these days, cameras are pretty good at this. So Denise, would you like to go to the next page, please?
Mhm.
So then this is another, just a layout of yet another section. And then the next page, please. And this is a potential, this is just, there's no live copy here, if you will. It's all what we call Greeked in. So if you wanted to include any statistics or anything from the state of Connecticut or the Office of Victim Services or the judicial branch in any way, it could be included here or not. We can do away with this page. The next page is an example of how the providers would be listed by city in the directory. This is just a sampling. There's probably about 4 or 5 pages of different providers. And the next page is the back of the brochure. And then the next page is a comp of what the card would look like that was requested. So I don't know if anyone has any questions, or Edith, if you have any comments. I think the purpose today was to get any feedback and answer any questions, and then in the next 2 weeks, get this completed.
I have a question.
Thank you so much. Oh, sorry. Thank
No,
you so much, Lori, for that. That was a great presentation. Yes, I look forward to seeing the product going forward, the DPH brochure.
Okay.
So Lucy, I think you had a question.
I did. I just, is there a way that we can look at this before it's finalized? I mean, one thing is our name is no longer, it's the Alliance to End Sexual Violence, and it says CONSAC. So that's, I just want to make sure that some of those things and that our member centers are included on the places to go. But also, I looked up the statute, and if it's something we're supposed to be working on, I think we need to take a look, Beth and Jesse. And I don't think it'll take long. I just want to make sure that before something goes out with our name on it, it's been okayed.
One thing.
And we do have a list of, we broke down the statute and made sure that it, explicitly said in the statute that this is a topic that, so we'll send along that document as well. That might make it a little easier for you to review.
Okay, great. Thank you. And, I mean, this is really the first I've heard of it. This is my first meeting, so I apologize, So.
No, we welcome input. We want to get this right. That's why. Yeah.
Lucy, hi, Lucy, this is Edith.
Hi, Edith.
Have you seen the previous brochure before? The one with the contacts? Oh, okay.
I may have, but I don't know. So it doesn't, if it was 2016, came out after I came here, before I came here. So it may be in our back, but I don't know.
Okay, I can send that along to you just a reference to what it used to be and what it looked like, if that would be
I mean, it looks
helpful. Great
with the pop-up and all that. Those things are really innovative. It looks good.
It looks very, very updated with the QR code.
Yeah.
And one thing I will, and I've said this before at these meetings, every class that we have, I saw this at a clinical training day on Saturday. The nurses who go through the SAFE training are all looking for a packet of information to provide to patients who report a sexual assault. And, we've had to stop and explain, and I have explained a number of times now that the SAFE Advisory Committee is working on putting together such a packet. And I even go into, the DPH's efforts to update the brochure, and that as soon as we have it, we'll put together a packet that is suitable for everyone across the state, not just for the SAFE program. Because this is a real, true, genuine need that we're hearing consistently from nurses, pretty much every nurse that goes through the SAFE training program. So we're very excited about, Edith and Lori and Jordan and the efforts that are going into this. Were there any other questions, though, about this?
I just had a comment, Denise.
Yeah.
something I've learned over the years sitting on many of these groups, and something that just kind of jumped out at me. I thought everything was looking really good. I just thought maybe for your consideration, you might want to think about, as far as like the pictures. I noticed it was like all female, and there are male victims.
Mhm.
So you may want to try to integrate, if you have room for other pictures, or you may want to think about integrating some men into the pictures too, just because they may receive a packet as well. So just food for thought on that.
Good idea, Mariel. I mean, certainly our patient population is increasingly diverse.
Are there any other, would you like us to explicitly include, for example, a lesbian that's obviously depicted to be, we know that it's all stereotypical, right? But and that's why I'm asking the question, right? So do you want to include that, or someone that is, any other kinds of images?
Yeah, I mean, I think if you have room to be as inclusive as possible, I would advocate for it, because again, like I'm saying, I mean, there's not just male victims, but there are victims, people who end up being victims of all shapes, sizes, races, diversity, I mean, sexual connotations. So, if you have room, I would say be as inclusive as possible.
Yeah.
One that we did too is we also included in our research, we also found specific guidance to the LGBTQ plus community. So there's a little paragraph. I think it's in the version, the sample version there, but we did identify that as well. So
I think if you do stats, and there are stats related to that too, I mean, that's certainly something you could.
Yeah. Okay. Because I think that people will tend to identify with it much better. We tend to be within our response area, we tend to be very homogenous, and we're really trying to increase diversity and really want people to, those who, that patient population, we want them to really identify with it in such a manner that they pick it up and say, oh, this is me, this is for me. So I think that's Mariel's really good point to make.
Could I add, when I looked at it, this is Pat Moriarty, I thought the same thing Mariel did. And also if you could include an older person, because we do get elderly patients as well as male. So they looked all young to me in those pictures. So just a thought.
Any other questions, comments? Okay, that was a great discussion. Thank you so much. It was a great discussion. Thank you. So the next thing on the agenda is the SAFE program website development. And I'm going to talk just a little bit. I have some questions I want to ask, but I really kind of sort of want to almost like do a recap of the need for this and kind of the purpose of it. So, and Mariel, you might have some, you might have some thoughts around this. So what we have seen is prior to the pandemic, healthcare, especially emergency departments, they were always, staffing was always an issue. Ratios were always with patient nurses, they were always a topic of conversation. Along came the pandemic. And with the pandemic, once we really got into the pandemic, many in nursing began to leave. They were heroes. Everybody was like, we're going to get through this. It's like 2 or 3 months. And then as the time went by, nurses were no longer the heroes, no longer treated as the heroes, but more to the point is the fact that they burned out. And so many of the nurses began to leave. We saw that here in the SAFE program. We lost half of our staff in the space of 7 months. But then, we're kind of watching this transition. So then now we have the vaccine mandates. So that added another layer So now you have others who are also exiting the staffing system and the infrastructure because of vaccine mandates. And what has happened as a result, and it's not just in this state, it is in every state. I sat in on a meeting yesterday of state coordinators, and there were, about half the states in the nation have state programs. And I felt like I was listening to what was happening here in other states, which is not only did they leave because of the pandemic, and they left because, and others left because of the vaccine mandates, but now we have this juggernaut called travel nursing. And travel nursing has become a thing where if you Google it, you will see that some of the pay rates, some of the lower end pay rates are $5,000 a week. Some of the higher end pay rates are $10,000 a week. And they're targeting ER nurses, ICU nurses, labor and delivery nurses, entire groups of nurses. So, and I will tell you that in the SAFE program, we have lost in the past month, we've had 4 resignations, and 3 of them were travel nursing resignations. In the list that I will talk about a little bit later about the annual competency days and the list of SAFEs in Connecticut, we've lost quite a few nurses from that list because they're off travel nursing. And so that has added to the strain and the stress of emergency nursing staff, which has also impacted the SAFE program. And now I just, this past weekend, had one of our longtime SAFEs come to me and say she was being deployed. So now we're looking at the possibility of deployments again. So needless to say, all of this has impacted our ability to meet the need. And yet the cases have increased, and we don't have the SAFEs. I have ER charge nurses calling me and almost begging for a SAFE because they don't have any staff they can spare off the floor. And we don't have any people really coming in and saying, hey, I want to be a part of the SAFE program. These are contracted vendor, which is nothing wrong with that. But there are contracted positions. They're not state positions. We know that people care about these patients, but we're kind of sort of in this valley. So the whole purpose of having a website is, which is why I'm bringing this to you, and I've given you the background so that you understand the context of it. But that website is intended to market the SAFE program as a response program. Pat runs a wonderful training program. We are not really having so many issues with getting people to train as SAFEs because a lot of people want the training. But having to be a part of an on-call program is a different matter. And that's what hospitals are looking for. That's what hospitals need. But it's very difficult to get the staffing, especially right now, to support that need. So what we're doing is we're developing a website. Linda has been able to get a meeting with what's known as the web board. It's the judicial branches, kind of sort of they have the oversight of the website for the judicial branch. And we're going to talk to them about having a page that is specific to the SAFE program. And there are 2 sections to this. One is, what is a SAFE? What is the role of a SAFE? The scope of practice, the qualifications, all of that information. The second piece of this is the SAFE program itself. You know, who do we respond to? What, how does it work? What is the scheduling? All those questions that nurses would ask. So what I really would like from this committee is, or ideas, if we have a section on SAFEs, the role, the qualifications, the scope of practice, the training. And then we have a second section about the SAFE program, its purpose, its participating hospitals, scheduling, pay. Can you all think of anything that could be missing? What would you look for on a website that would not be covered by those 2 sections? And I'm posing that question to you as the SAFE Advisory Committee.
Could you repeat the two sections?
Sure. It's one, the first section is on the role of the sexual assault forensic examiner, what it is, what the qualifications are, what you do, the scope of practice and the training. That's one section. And that's kind of general, because too often we have people who apply for this program, and to be very honest, they watch CSI and they don't really know what the role is. So, and then that second section is about the SAFE program itself, the different components. So if you were a healthcare provider and you were interested in being a part of the SAFE program, what kinds of information would you be looking for? Or do you think that covers it?
Yeah, I'm struggling a little bit to think of more than what you've currently identified. I think once it's together, perhaps more feedback could be provided if there's something that's not there. You know what I mean? I think we could say to healthcare providers, like, is there anything missing? But I think you were at the right, I think you have all the right elements that we would expect. So yeah, I'm struggling to come up with other ideas, but it doesn't mean they're not out there.
Yeah.
I have a question. In any of that, is there information about their expected time commitment? Or can we not do that?
There would be, that's one of the, basically under the, not so much the qualifications, but the expectations, I would say, not requirements, but expectations.
Okay.
So what we thought we would do then is certainly, Mariel, the idea was to put it out there and then maybe have a little section where are there other questions where people could have a place to write their questions. And that way we could start to make it more robust, if you will.
Yeah.
So my
I'll just add, Denise, to your earlier statements about the environment for nursing. I wholeheartedly agree. And it's not just nurses that are leaving healthcare. It's across the board. There are a lot of provider types that are just, as you said, burnt out. But the travel nurse issue is truly stressing the nursing community, because people are literally leaving to go work. They worked next to their peer yesterday as their peer, and the next day they're working under an agency and making a whole lot more an hour than they were yesterday, and that person who works with them knows that, and it's causing a lot of strife, amongst the individual nurses, even within facilities, and that's not just hospitals, that's everywhere. So
yeah,
it's truly, the struggle is real right now.
It is.
I completely sympathize with what your program is experiencing.
Yes. And so we had at this meeting I went to yesterday, I heard one state coordinators basically said, well, if I didn't have 3 kids, sure, I'd go leave my position and go work for $10,000 a week. And then another state coordinator, these are what they call SANE programs in their states. These are state coordinators who do exactly what I do. And the other one said, she said, I don't know about, she was Southern. She said, I don't know about y'all, but she said, I'm a little bit worried about us. So, and I was right there with her. And I think we were all on the very same page. And what was helpful for me was to know that it wasn't anything we were doing here in Connecticut. It was the state of healthcare. And we're in crisis. We know we're in crisis. And our job is to kind of sort of work our way out across that crisis to where we can get out of the valley and start climbing up the mountain again. So Linda, I don't know if you have anything you want to add.
No, I think you've summed it up well. I'm very excited about getting in front of the web board. And I don't know the turnaround, but I mean, I think to give the SAFE program its own identity for healthcare providers to research, I think is great. Excuse me, I'm working on a problem and my phone's ringing. Hold on.
So the idea behind this website is that what we would like to do is market this to other nursing subspecialties outside of the emergency department. One of our safes, and I will be honest with you, she's very open about her age. She is retired. She does probably 60% of our cases. She does so many cases that a hospital will call me up and say, I'm desperately needing a safe. Do you happen to have one on? And in the middle of that conversation says, oh, Melinda's calling in. And so they know her by name, but she's 74. And so, yeah, so good and good for her. She loves this work. She's very good at it. But so one of the groups that we're hoping to market to is maybe those who are in the retired section, but who want to keep their hand in. So, which leads me to a couple of other things. One is Professor Sherry Watson, who's not able to be here today. I did get an email from her earlier this afternoon because she's out of the country, but she obtained permission from the Connecticut League of Nursing's website to post on their website, and that's 4,500 nurses plus. So I'm going to talk to Linda, and we're going to, in lieu of having the website ready to go, what we're going to do is to post maybe a fact sheet and a little inquiry for interest. So if we could even just get a fraction, if we got like 2%, I would be happy. And then she's waiting to hear back from the Connecticut Nurses Association about doing the same thing. So that's in lieu of the website. And so hopefully by the time we get the website up, we'll already start being able to market this to other nursing subspecialties. Does anybody have any questions about what I've said so far? So my next question is, when we post the website, I'm going to come back in January when we have, I hope, a little bit more about the information. And one of the things I'm going to ask everybody to do is to look at how you can yourselves share information about the website. So we're going to do it from this end, but that's something we're going to look at, and we'll come back in January and ask for ideas on that. Any other questions? Okay. So the next thing is the annual competency days and the list of safes. So we have 2 more annual competency days left, November 23rd and December 9th. We do have people registered, but just so you all know what the count is, the current count is 117 safes in the state of Connecticut, in spite of what's going on with the SAFE program. And that doesn't include the fall class. We're still in clinical training with the fall class. Once that class is done, we will actually have about 128 safes in Connecticut. I'm still waiting to hear back from a few stragglers about attending annual competency day, but I will have that final list for all of you at the January meeting, and along with the statute, and then questions to you all, where to post it. We had talked at the last meeting, Mariel, about CHA, and Edith about DPH being able to post this. So I'm going to ask, is that still possible on your websites?
Yes.
We won't be able
Yes,
to
it
post
is.
it on our website, but I'm happy to share the link to where you're.
Okay.
Yeah, we can't put it on our website though.
Okay.
And
But
our
if you
members
can share it, it's still the same thing.
Yeah. Yep. But we're absolutely able to share it. Yes.
Okay. So, and Edith, you said DPH can.
Yes. Yes. Same here.
Okay, thank you.
Mhm.
So the second question that I have to you all is who should be able to have access to that list? Should it be limited to healthcare providers? I will tell you that I recently had an inquiry from a state's attorney who would like for the state's attorneys and also the defense attorneys would like to have a list of experts. So, and yeah, so I don't know if they should have access to this list. I've basically been putting it off and saying, yes, we have safes, but whether or not they're experts, that remains to be seen. That would be a judge's call.
I was supposed to say, like, what does Denise Poncini think? But I want to put her on the spot.
So, but this is not the program. This would be.
But you train them, yeah, and it's your, and you have the info as the state agency. So I don't know. Guys, I don't know how to comment.
That's my question: is who should have access to that list?
So, Denise, if I can just weigh in with the request from the state's attorneys, we always have a need for witnesses to speak about or educate juries on sexual assault victims, what survivors, what should be expected, how they react, how they don't react, and for a variety of issues. So it may be something where it's a double-edged sword. If a safe is willing to testify in a case where they did not perform the kit, it gives them good experience and it gets them familiar with testifying in court in a case that they don't have any stake in, right? So they're going to be a little bit more relaxed and gets into practice. So if there's individuals who are willing, maybe it's just something that you throw out during the competency days where it says, if you're willing to testify in a case, if you're willing to consider it, leave your information and then you distribute that rather than distributing a list. Because some people are so hesitant about testifying that they don't want to become a safe, So let's say they get over that and then you get some safe, some assistant in Tallinn who happens to pick that individual off of a list.
Yes, that's why I've actually not replied to that. I've just kind of put it off.
Yeah, I think we safeguard it a little bit, but I do think it's a very good opportunity for someone who's willing.
Okay. Denise, do you have a viewpoint from judicial?
I would agree that it should not be generally available. We don't hire them as experts. I think that should be a personal decision that the safe makes, and it shouldn't be that we're billing them as potential expert witnesses. And I think that it should not be a generally available list. I have opposed having it on our own website open for the whole world to see, because I think you're probably not going to get more safes if that's the case. So if it's somewhere where people that are seriously looking for something like that can find it, I feel more comfortable about it. A list available for the safes to see who else is there. I think the hospital should have access to it to make sure that the person that is coming in is on the list. That's important.
So originally my thought, and I'm just going to share this, originally my thought on the matter was the hospitals, because many do put this on their resume, and it is an attraction for hospitals who are looking. It's kind of an added bonus for a hospital to have somebody who's trained as a safe, but also safes themselves, because sometimes they may not be on a list that they think they're on, or vice versa. So those were the two groups that I thought would have, when we started talking about this, I thought would have access to the list. And in Charmise, it wasn't until I started getting questions from prosecutors that kind of raised the question for me. And I don't know, maybe that's a further conversation that needs to take place, because certainly I understand, Charmise, the need for experts. Experts get hired by defense attorneys all the time. And I know that some of the prosecutors have said, well, we kind of also need this as somebody who's not already tested, who doesn't, as you say, have a stake in it, but who can talk as to standard of care. And maybe it should be strictly on a voluntary basis. And I certainly wouldn't suggest that somebody be billing themselves as an expert who has not been through SAFE training. So that limits the pool to those who have had the training.
Right, and so that's an area that you can't really control, Denise, and that's what you're gonna get.
Yeah.
Defense attorneys do hire experts. If they can't find someone who's safe trained, they're gonna hire someone who says that they are knowledgeable in the area and who build themselves out that way. Prosecutors, we hire experts generally for sexual assaults. So for a while, it was in the area of forensic interviews with the sexual abuse of children, and now you're starting to see where there's a need for expert testimony in other areas. So it's something to consider. I like what Denise Porcini said about, it has to be an individual choice, and it should be guarded. But, if someone feels comfortable in what their area of expertise is, it's not for us to tell someone that they're an expert. It's for them to say, I feel I have a level of expertise in an area. And so the other thing I don't want to get into is something where this committee is saying which safes are qualified to be considered as experts, because that's not
the purpose. Yeah. So if it's okay with you all, why don't we, at this point in time, say it's accessible to hospitals and accessible to safes? Is that agreeable to everybody?
Yes.
And then once that list is up and available, and we can see how it goes and see what the need is and what's appropriate, if anything else. Would that be agreeable to everyone?
Yes.
Okay. And so any other questions on anything I've brought up or asked questions about? Anybody have any comments? Okay, so I'm going to turn it over to Pat Moriarty to provide a training program update and let you have a chance to ask questions of her.
Thank you, Denise. Hello, everyone. Just a few updates, but very busy with training. We're in the midst of the fall safe training class. We have 11 students in the class, 10 of which are from emergency rooms across the state. And right now we're in the midst of the clinical portion. We have our second clinical day this Saturday, and then mock exams are 3 days next week, and that will conclude the fall class. And it is going very, very well. The Train the Trainer program is also we've had 3 classes. Tonight will be our 4th and final class, and we have 7 safes that are in the program. The goal of the program is to promote a consistent statewide education on care of the patient who reports sexual assault. So it's and that way everyone's delivering the same training and message. So Train the Trainer final session tonight. Linda will be attending, and we expect they've all been expected. Their expectations are to present a very polished and professional presentation as though they were presenting to hospital staffs for a hospital training, and they will be graded. Not everybody will graduate, and we will continue classes every few months. So it's been very, very well received. We've also been working in collaboration with the Connecticut Hospital Association. Thank you, Marielle, and you can add in also. And again, what we're trying to do is promote training across the state, and we, with the assistance of CAHA, are going to, in collaboration, offer a CEU-approved training, one for providers and one for nursing staff. So the provider training will be 2 hours, and the nursing one will be 3 hours. It's basic training. At the present time, it will be virtual, and an introduction to the appropriate care of the sexual assault patient, as well as a review of all the steps in the sexual assault kit. So that's still a work in progress. Denise and I met with Marielle and Christine last week, and what we're going to do is come up with a sequence of dates. And that way, training's ongoing. They can choose which, if they can't make one, they can say, well, maybe I can make the other one. So again, training. We've also had a request for training of law enforcement. Ann Mahoney we've been in collaboration with her, and once the fall SAFE training class concludes this semester, we will begin a 2-hour, well, we're trying to decide. Anyway, it's a work in progress, whether it's an hour and a half or 2 hours. Law enforcement tends to want brief, so it's going to be a presentation that's just specific for law enforcement to encourage attendance regarding the care of the patient who reports sexual assault. And we do monthly QAs for all our SAFEs, and we also invite any hospital staff that have taken the SAFE training. We open the invite to them. For example, last evening from 5 to 7, we had 2 licensed clinical psychologists, and they spoke on mental health challenges in the workplace. It was an excellent presentation, a lot of collaboration. SAFEs shared stories and questions regarding care of the patient. So as you can see, it's been busy. Does anyone have any questions?
Hey, Pat?
Yes.
Hi, sorry. Let me raise, I can't hear. I'm just curious, because you mentioned this training with police this morning and now again. When with working with Maureen, did she make any indication that we might be able to get post credits, credits from the police officers training? Excuse me, standards council as a for the police?
I apologize. I misspoke this morning. It was not Maureen Platt. It was Ann Mahoney. So I don't know for the life of me what I said Maureen Platt, but it's Ann. I'm working with Ann Mahoney.
So I'm wondering, did Ann then mention something about trying to get post credit as an incentive for them to apply, to attend?
No, she didn't, but it is a possibility. Maybe she will suggest that once we complete the training and she reviews it.
Thanks, Pat.
Yeah, Linda, just to chime in, the original request actually came in to me as part of a different conversation that she and I were having, and she was actually one of the ones looking for SAFEs to testify. And I was explaining some of the issues we were having with law enforcement. And that's where that invitation came from. It was an informal invitation. There was nothing about post or credits.
Well, if we're going to take the time to develop it and work with the state's attorneys in each of at least starting with where our hospitals are, it seems like that might be a worthwhile, again, as I said earlier, carrot.
Agree. Just like Marielle developed the care.
I'm just so excited to be working with everyone too, and as Pat said, we're just gonna do our best to offer what we can, and and adjust as we need to, and just train where we can, right? And I'm just so excited to have partners in that.
Yeah,
it is exciting.
For those of you who may not be aware, Pat's been on board for a couple of years. She's done an incredible job. But prior to that, it was a struggle for me to both run the program and run the training program. Marielle, you very well remember some of the many, what was it? There was a meeting that you kind of sort of threw it out that they needed to train their staff instead of transferring to hospitals.
Yeah.
Yeah, I think I got something like 26 requests for training. So I am so grateful to have Pat and not have to worry about doing that. So I can focus on this side of things. And you all are a part of that. So any questions for Pat on training? Any suggestions for other groups that need training? Okay. So with that said, we're down to new business. Anyone have anything they'd like to bring up? No, everybody's so quiet. Okay. So with that said, we're going to let you out a little early. It's just now going on 3 o'clock.
I actually do have a scheduling question.
Sure.
So on our schedule, our meeting schedule, it seems like we're doing the second Wednesday all throughout until September. Is that intentional that we changed that one day in September?
I saw the same thing, Natasha, and I was like, wait a minute,
Yeah,
what's going on here?
that, you know.
Yeah.
So Linda, do you know why that was? I know she may be on the phone. I didn't come up with the dates. So I didn't see that there was a
Well,
difference.
it's not a problem right now, but just verify that that's the intent, because it's
yes,
the
and
only
I will.
one that's not the second Wednesday.
So which one is not the November? The November one?
September.
Okay.
The second Wednesday would be the 14th.
I'm wondering if that has to do with class. But generally speaking, it is the second Wednesday. If there's a date, it may be because we're running this fall safe training class, which are all day classes. So our next meeting then will be January 12th at 2 p.m. We plan to have much more information on the website on the list. You'll be provided with a list. Also, Edith, I don't know, are we going to be able to have the brochure well in hand by then?
Hi, I believe so. I think I'll continue working with Lori and Jordan on the details. And thank you so much, everyone, for your feedback. That was really great information for the brochure. But I'm sure that by then we should have a polished product for you to view.
That'd be great. And then we'll kind of regroup for the new year. And I hope everyone has a wonderful, wonderful holiday, both Thanksgiving and Christmas. Thank you, everybody, for attending and taking the time.
Denise, you too.
Thank
Happy
you, Denise.
holidays, everyone.
Happy
Thank you.
holidays.
Bye-bye.
Bye-bye, everyone.
Thank you, everyone.